Good morning, ladies and gentlemen. Welcome back to week 8 of this course on physical medicine and rehabilitation in sports. This is lecture 4, and here we will be discussing the psychological impact of sports injuries. I'll be discussing this lecture as per the following outline: introduction, objectives, emotional responses, psychological stages, role of sports psychologists, role of coaches and family, future trends, and as usual, we will conclude with a take home message. There is a strong psychological impact in sports injuries, and injuries can affect the athletes mentally and emotionally. Because of this, we should be aware of the psychological responses to injury. And there is a very relevant importance of mental health awareness in sports recovery. Few years ago, we never used to talk about mental health and uh, sports psychology. Now, every injured athlete has to go to a sports psychologist. The objectives: to understand the psychological effects of sports injuries, to identify the common emotional responses to injury, to explore the psychological strategies for recovery, to discuss the support systems for injured athletes, to examine long term mental health implications. There is a mind body connection in sports injury, and there is a strong interplay between physical injury and mental health. There are several psychological factors which may affect the recovery from injury, which we'll be seeing in a subsequent slide. Stress, anxiety, and mental resilience are psychological factors which may play a role in injury recovery. More importantly, mental fatigue may play a role on physical rehabilitation. The common emotional responses to injury are shock, denial, anger, depression, and acceptance. Injury severity and duration may have a psychological impact. If the injury is severe, requires surgery, and long term rehab, the psychological impact may be greater. There may be variations in responses based upon the personality of the individual and the coping mechanisms. If the individual has been injured in the past, he or she may shape his current emotional responses based upon the past experience. It may be a positive impact or it may be a negative impact. Psychological stages of injury recovery. There is something called the Kubler Ross grief model, and it applies to sports injuries also. The various stages are denial, anger, bargaining, depression, and acceptance. It is important for the athlete to move through each stage for effective recovery. And there may be individual differences in processing injury related grief. Depression and anxiety in injured athlete. This is very prevalent amongst injured athlete, and we must be watchful for the signs and symptoms of depression and anxiety. If the athlete is remaining aloof, he's got difficulty sleeping or early morning wakefulness, if his heart rate is high, he keeps sweating, all these things are signs and symptoms of depression and anxiety. There are psychological assessment tools for early detection of these conditions. And if the individual struggles post injury, these risk factors may contribute to mental health. Loss of identity and self esteem. The athlete loses his identity post injury and suffers a severe identity crisis. For example, he is a star batsman or a star bowler. He gets injured. He is removed from the team and he suffers an identity crisis. The injury has effects on his confidence and self worth. And the sports psychologist and his team must work on strategies to rebuild his identity during the rehabilitation. The athlete may be put into coaching or mentoring as alternative roles during his rehabilitation phase to give him an enhanced sense of self worth and make him feel useful. Fear of re injury and return to sport. This is a strong psychological barrier to resuming training and competition. And this has an impact on performance and decision making. The psychologist and the team should work on techniques to build confidence for return to play and gradually expose the athlete to sports specific activities to improve his confidence and reduce the fear of re injury. Social and emotional isolation. Because of lack of team participation and support, the athlete feels socially and emotionally isolated. He develops feelings of loneliness and disconnection from his sport and his team. So, there is an importance of maintaining the social involvement with his team members. And you must work on strategies for the injured athletes to stay engaged with their teams. Make sure they attend practice sessions, they attend the games, they interact with the players, and make sure the players and the coaching staff give the injured athlete only positive support. If there is a long term or a career ending injury, there are severe mental health consequences of these permanent injuries. We have to teach these athletes coping mechanisms for transitioning out of the sport, for moving out of the sport. The role of career counseling and future planning is very important for these athletes. And each team must have a strong support network for career ending injury cases. There are different psychological differences amongst the athlete, and this variation in responses may be based upon age, gender, level of competition, family support, cultural background, etc. There are certain unique challenges which are faced by the elite athletes as compared to the amateur athletes because of fear of loss of income, loss of status, loss of job, etc. There is an influence on the cultural background on injury perception. And experienced athletes are more mentally tough and can cope with injuries better. Role of sports psychologists in recovery. Strong importance of psychological counseling pre-injury, during injury rehab, and post return to sport. There are several techniques which are used by the sports psychologists for injury rehab. And there is a good collaboration to be established with the coaches, the medical teams, and the family. The sports psychologist should also discuss successful psychological rehabilitation case studies with the athlete, the teammates, and the support personnel also. Coping strategies for injured athletes. Now, each of these are a lecture in itself, so I will just be touching upon briefly. Positive coping mechanisms are visualization, mindfulness, and goal setting. Negative coping behaviors are substance abuse, withdrawal, and aggression, which should be watched out for and corrected in a prompt manner. The athlete must be trained to develop resilience through structured rehabilitation and encourage positive mindset shifts for recovery. Role of coaches and support staff. Strong psychological support is required from coaching staff. The coaching staff and the support staff should always be positive, always be open and effective in communication with the athlete, reassure the athlete, and give encouragement always during all dealings with the injured athletes. And change your coaching strategies to help the athlete regain confidence. Family and peer support. Strong role of family and peer support in emotional and mental support. Peer encouragement and shared experiences is a must for improving the injury recovery. Have a positive team culture on recovery mindset and make sure this positive team culture goes into the recovery area also. Teammates can foster a supportive environment, and please have discussions about how teammates can foster this and how coaches and support staff can help in fostering a supportive environment for an athlete undergoing recovery. Mental skills for injury rehab. Techniques such as imagery, self talk, and rehabilitation are being used nowadays. Cognitive behavioral therapy is used in sports injury rehab. Goal setting approaches help to aid motivation and to allow the athlete to see how much he has progressed. And always remember, everybody around the athlete should be positive and give positive affirmations and focus exercises for the athlete. There are several factors which affect the compliance with rehabilitation protocols. And please be aware of the strategies which help to maintain motivation during long recovery periods. There are several strategies and compliance factors which are available as per the sport online. Please be aware of these and please use them in your rehabilitation. There is a strong impact of psychological intervention on adherence to rehabilitation protocols. People who get psychological support will adhere to the protocol more. And please use short term goals to sustain the motivation in these injured athletes. The role of mindfulness and meditation. There are several benefits of mindfulness in sports injury rehabilitation. They can be used for reducing stress and for improving focus. Mindful based interventions, case studies are available for study and for teaching the athlete and the teammates. Please use guided meditation for pain management and relaxation so that you can reduce the role of drugs in pain management. The placebo effect in recovery. It is effective, but we should be aware how belief in treatment affects the recovery outcomes. We should be aware of psychological versus the physiological healing in sports medicine. Placebo effects in injury rehabilitation. Several examples are available, and we should be aware of them, and we must teach our athletes this. And there are strong implications of the placebo effect in recovery for sports medicine practitioners. Psychological preparation for return to play. Build reconfidence post injury. Give small doses of exposure therapy and gradual return to sport to the athlete. Train the athlete for improving mental resilience and give him coping skills for overcoming self doubt and fear of re injury. There are several psychological screening and assessment tools which are used to evaluate mental health in injured athletes. They may be standardized questionnaires, they may be interviews. And it will help you to monitor the psychological progress throughout the rehabilitation. There are several case studies which demonstrate the effectiveness of these screening tools and should be made aware to the sports psychology team. We must be aware of examples of athletes overcoming psychological injury challenges. We must be aware of the success stories and the strategies applied. We must be aware of the psychological rehabilitation plans which have been used in elite sports. And we must be aware of the lessons learned from real life injury cases. We must use all of these in our injury treatment strategies. Future trends. There are a lot of emerging trends and technologies such as virtual reality for mental recovery, artificial intelligence for mental health assessments, and there is a strong evolution of sports psychology in injury rehabilitation using emerging technologies. Recovery is a multidisciplinary approach and should need a collaboration between psychologists, physiotherapists, coaches, and sports medicine doctors. We must practice holistic recovery programs integrating mental and physical rehabilitation. We must be aware of the best practices for team based rehabilitation approaches and importance of long term mental health monitoring should be clear to everybody involved in sport and should be practiced. Psychological aspects of sports injuries should be known and assessed very early. We must be aware of the importance of mental well being in overall recovery. We must encourage a proactive approach to mental health in sports, and we must foster resilience in injured athletes. These are my references, ladies and gentlemen. This brings us to the end of lecture 4 of week 8. Thank you very much for listening, ladies and gentlemen. Thank you and Jai Hind.